dedicated only to what you see here is improving bunion outcomes. So definitely tap their expertise. They'll show you how the instrumentation works. Super cool, very elegant on how we've been able to take a very difficult problem. And believe me, bunions are a difficult problem. It sounds like a very mundane problem, right? I told my mom I'm going to be a bunion surgeon. She's like, really? You're going to be like a heart surgeon or something, cool? Well, bunion surgery is cool. So, and
it is cool.
We're going to tell you a few things about it. So, the one thing about bunion surgery is there is a lot of myths about bunion surgery. And most of the myths are actually bad. So, the reputation of bunion surgery is terrible. If you talk to somebody that's had bunion surgery, there's a 50-50 chance they're going to tell you it didn't work, it was horrible, it was painful, and they had to have it done over and over again. And that is really the reality of bunion surgery prior to 2010. So myth number one, is this true or false?
False.
Are bunions caused by shoes?
It's a myth.
No, they're not caused by shoes. Everybody that has a bunion knows that they got it from a family member. It's genetic. It's a hereditary problem, so you're not causing the bunion. It happens whether you want it or not, and there's really not anything you can do to prevent it. And our patients, I think when they come in sometimes they're a little bit shy and they're like, oh, I have a bunion, I don't want anybody to know. Well, a third of the population has bunions. You're in a very big crowd. A lot of people have bunions. It's a huge issue that people deal with, and I think this was a trivia question, so I'm going to give it away so everybody will get another one. There's over 400,000 bunion surgeries in the United States a year. So it's a big issue, it's a big problem. And so shoes certainly irritate it. Shoes can cause problems, but they don't cause the bunion. So myth number two is, hey doc, I've got this bump on my toe. Can't you just shave it off? And that's absolutely a myth. A bunion looks like a bump. I mean, you can see it on the foot. It sticks out, it looks like a bump. But it's not a bone growth or extra bone. It's actually a very complicated structural deformity coming from those genetics. So it's bones moving out of place as we walk. So we're not born with a bunion. We're born with a predisposition to develop that bunion over time. And so this process ensues where the big toe metatarsal moves away from the others, and I'll show you an x-ray of a normal and an abnormal, and it'll make more sense. So this is a normal foot, so these bones, the metatarsals in the middle of the foot and the toes are all parallel, right? They're all straight. That's how it should be. This is actually, not to brag, but this is actually my foot. And this is a bunion where the metatarsal has moved away from the other metatarsals. And as that happens, these two little bones on the bottom get displaced, the toe moves over, and eventually the big toe gets arthritic and wears out, and that's when the pain really starts. So it hurts when it's a bump, but it really hurts when there's arthritis. So myth number three, bunions will go away on their own, or you can do something to force it away. Or if you read Dr. Google, they will tell you, buy this device, and you put it on your toe and you crank it, and your bunion will be gone. I don't know how they can make that guarantee. If that was true, there would be no such thing as bunion surgery, which would put Mindy and I out of business. You can't have that. But no, you can't reverse the process because, again, it's an ingrained structural process in the foot. So what if you don't treat them? Well, by nature of the problem, it's progressive, right? It's going to get worse over time. Now, bunions don't always get bad enough that people need to have surgery. There's lots of people that have bunions and they never get to the point where they're symptomatic enough to have surgery. And we probably talk as many people out of surgery as we counsel to have surgery. So it just depends on the individual. But it is progressive. It will get worse over time. We unfortunately can't stop that short of surgery. And there are a lot of other associated things like bunions and hammer toes. They're like, what did Forrest Gump say? Peanut butter and jelly? Mm-hmm. Is that what it is? Yeah. I mean, they go hand in hand because the big toe is pushing the other toes out of the way. So it is a progressive problem. And so myth number 4 is near and dear to our heart because 15 years ago, we completely stopped treating bunions the way we were taught to treat them. And that was to treat it like a bump, shave it, cut the bone, move it over, and that just simply is not effective consistently. Matter of fact, if you look at the studies, And there has been thousands of studies on bunion surgery over the last 50 years. This is what you get when we don't understand the deformity. And I showed you a normal, I showed you some bunions, and when I look at these people that have had bunion surgery, I honestly would rather have the bunion back, because this is a mess. And these are the cases that we're really sad for our patients, because they have to have multiple procedures to correct that first problem. And that was our goal back in 2010. We said there has to be a better way. There has to be a more reliable way to correct this. And so, a little bit fast forward, but a little bit of a spoiler. So this is Lapiplasty. So if you look at that foot, this is the same patient, old fashioned, new fashion. If you don't look at those plates, that's a normal foot. And that's our goal with Lapiplasty, is to make everything back aligned to normal. And this really tells the whole story of what we're trying to do. Now, it's a complicated process, and we have all of this instrumentation and technology and research to be able to produce that. But it's super important that we realign everything back to the normal position. So this is another myth. So most of the traditional operations keep you off your feet for a long time. Many of them require casting, crutches, out of commission for literally months. Again, one of the tenets of Lapiplasty, really one of the first things that we said, if we're going to do a surgery for a patient, we want them to be able to move and use their foot almost immediately afterwards, because that's incredibly important and incredibly powerful for their recovery. People heal faster if they're moving. So if anybody in here has had a knee replacement or hip replacement, what do they tell you? You got to get up and you got to move. That's so important for the recovery. And it's the same thing for any bone or joint surgery. And so what we expect with Lapiplasty, so Lapiplasty, when we do a procedure, it's an outpatient procedure. It's usually a little less than an hour. You do go to sleep for the procedure, but you go home right afterwards in a bandage. You're allowed to put some weight on your foot, get around the house, take care of yourself. And then you're in a boot, one of those big black boots that everybody at Hy-Vee wears now, you know, goes up here. And so you're in that boot for about 6 weeks. You don't have to sit in it, you don't have to sleep in it, but when you're up and walking, you're in that boot, and that protects you so the bones can heal together and meld together. After about 3 months, most of our patients are starting to get back to pretty much all of their activities. It's bone and joint surgery, and again, anybody that's had a bone surgery knows that things are great at 3 months, but it takes a year for everything to be completely normal again and back where you're not thinking about your foot anymore. But the key is no cast, no immobilization. You're moving, you're using your foot right away. We don't hide you from your foot when we operate on it. We reintroduce you right away to your foot. So this is another myth. It's like, oh my God, I can't have bunion surgery. I've heard horror stories. It's so painful. It is awful. Complete myth if it's approached correctly. So our patients rarely need to even take a narcotic pain medication. We use something called multimodal pain management. I'm not sure why every surgeon doesn't use it, but it's a combination of things we do before, during, and after the surgery that actually stops pain. Right? We're not trying to control pain, we're trying to stop pain. And part of that is movement. So we're actually going to be starting a study soon, but for the last 10 years, we've probably been the lowest user of narcotics of any foot and ankle practice, and maybe in the country, I know for sure in the state. And we do that by, again, looking at the whole picture, looking at all components of it. And so myth number 7, again, when you take all of the traditional issues with bunion surgery, you know, painful, doesn't work, have to have it over and over again, it makes you think that there's no good way to fix a bunion. There's no hope if you have a bunion. But in fact, this is now the patented procedure with a very elegant instrumentation that we've been able to research. I work with a group of 7 other surgeons from across the country, leaders in foot and ankle surgery, to develop this instrumentation and also to do the research. It's very important that we prove what we're doing works. And now after 15 years, I think we're getting to the point where we can say pretty definitively that it works. So this would be what we expect on average after our patients go through the surgery. We have about a 97 to 98% success rate with realignment back to normal and a successful outcome. Now, we're not going to talk about big toe joint arthritis. Half the people with bunions have that. Luckily, we have a solution with Lapiplasty for that as well. But this is patients without arthritis. So the procedure itself, I guess it's new in the scheme of things. You know, bunion surgery has been around 50, 60 years. This has been around 15 years, so I guess it's new, but it's not new from the standpoint that it's experimental. So we have actually now about 65 patents on not only the technique, but the instrumentation. It's obviously FDA cleared since the time that we introduced it. We do train surgeons. We've trained about 3,000 surgeons. Mindy and I fly all over the country and do labs and train surgeons in the technique. It does require advanced training. It's a complicated operation, so the more you've done, usually the better the results are going to be, and that's whether it's your heart or your gallbladder or your big toe. I mean, experience matters. We've done, I think to date, I don't know, in the neighborhood of 1,500 corrections since the system has been out, so we're getting a pretty good handle on it. So this, it's not super gross, but this isn't surgery, so you can look away if you want, but I would recommend not, because this is really, really the magic of the procedure. So you can see the bunion, the big toe sitting over the second toe. This patient had a hammer toe operation at the same time. But this is how the instrumentation works. We've been able to develop this very elegant instrumentation that literally just dials the deformity out. There's nothing else in foot and ankle surgery that actually will correct a deformity like this. And if you look at the bones and you remember what we talked about, that metatarsal being over and those sesamoids being out to the side, you can see we can just dial it away. And then at that point, we just prepare the joints and put those two nice little titanium plates on, and we're off to the races. So, and this is typically what we expect to see. And if anybody has a bunion, you know, you want your foot to look like that, right? You want it, after a year, you want it to look like a very functional foot that you can count on to, and we expect our patients to golf and pickleball and run marathons. We don't have any limitations after surgery as long as everything goes as planned. And so, again, evidence is so important. We've been involved in over 25 publications, peer-reviewed publications, looking at the results of the procedure. And people say this all the time. It's kind of funny. Minnie and I were laughing about this one night. We're like, you know, people are always saying, you know, we wrote the book on this, you know, I wrote the book on that. Well, we really did actually write the book on that. This is the most recent book. It's a textbook devoted only to bunion surgery. We published it in 2018, so it has all the new evidence. The textbook prior to this was published in 1970. So that just gives you an idea of a little bit of gap in change and knowledge. So we don't just do bunion surgery here. It's what we love. It's what we've really you know, kind of built our most recent reputation on. But we do a lot here. We take care of everything, foot and ankle, from injuries to sports problems to warts and ingrown toenails. Ingrown toenails are great. If anybody has an ingrown toenail, we do a great permanent correction of ingrown toenails. It's one of my favorite things besides bunions. Orthotics, and I would you know, welcome everybody to take a tour in the office and see the technology that we've been able to invest in and develop and provide to our patients. Because that, and the bottom line, that's what it's all about, is we want our patients to get better, we want them to have a good result, and we don't want anybody to have to do this twice. Mm-hmm. I mean, that is, you know, if I were going to have surgery, if somebody tells me, well, we'll do it, it'll probably last 5 years and we'll do it again, I'm like, I'm living with it. I'm not having 2 surgeries for this problem. So, you know, it's a medical procedure, so things can happen. There are rare complications or times where people need something else done, but the fact that we can, you know, kind of hang our hat on this 97% success rate has been phenomenal for us and for our patients. Mm-hmm. So.
Great job.
There you go.
Way to go.
And if anybody wants a QR code, I'm a workshop guy at home. I have a metal shop and a wood shop. So I lasered out some of these QR codes on posters. So
Yes.
we'll do a couple of trivia questions and we'll give some of them away because I can only have so many posters.
Or if you leave a Google review, you can get a coaster.
Leave a review.
Yeah, leave a
You
review.
leave a review. That's the
Yeah.
deal. You leave a review.